Wellness for Life is brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, and Mojave Ottawa Community Action Partnership.
Hello, I'm Matt Koffenberg, physical therapist and owner of Perham Physical Therapy. Today we're going to talk about a common knee injury. It presents itself as pain on the outside of the knee. It's quite common in runners, and it's called IT band friction syndrome. Now, the IT band is a long piece of connective tissue. It actually starts at the pelvis and it goes all the way down the thigh and attaches just below the knee. So if we look at a quick drawing of the IT band, this is actually looking at the side of someone. This would actually be the hip area, and this would be coming down the thigh, and then we get to the knee with the kneecap. So the IT band is represented here by the blue section. That IT band, again, is really long. Again, it starts at the hip and it comes all the way down and attaches just below the kneecap. So we've got the buttock muscle here, or the glutes. We've got the hamstring muscle, and then we've got the quadricep muscle. All of those muscles actually blend right into that IT band as it comes down the outside of the knee. Then if we look straight ahead at the knee, this is specifically the knee without the kneecap. We've got the bone that comes down on the thigh. That's called the femur bone. That femur bone actually has some condyles, and these are the condyles. They've got one on the outside and one on the inside, and then this would be our tibia or our shin bone. And the blue, again, is representing the IT band. As the IT band comes down, it actually attaches right into our shin, just below the knee. Now, functionally, as we move the knee, as the knee extends and as the knee bends, that IT band is actually moving in front of this condyle, and then it moves back behind the condyle. So when we straighten the knee, it goes in front of the condyle or in front of the femur, and then when we bend the knee, it actually comes back behind the femur. Now, when that becomes problematic, what will happen is that if this hand or this fist represents one of the condyles, and then this hand represents the IT band, what should happen is the IT band should just move back and forth. But what happens in IT band friction syndrome is that IT band actually bangs right into that condyle. So every time it moves forward, it hits the condyle. And when it comes back, it hits the condyle again. And when it repetitively hits the condyle, or repetitively hits the bone, that IT band becomes very irritated and it becomes inflamed. And then you get the pain on the outside of the knee. So then the big question is, well, why in certain circumstances does it not hit the condyle, and why in other circumstances does it hit the condyle? The two biggest reasons are mechanical in nature. The first reason we call a lateral pelvic tilt, and the second reason we call foot pronation. Those two conditions can cause that IT band to bang right up against the condyle. So, again, I mentioned earlier that this is common in running. So if we look at this other stick figure drawing, this would be an ideal situation of someone running. So the right leg is landing and the left leg is back. And what should happen is the knee should stay right above the hip. Again, the blue is representing that IT band. The knee is staying right above the hip. Now, if the knee rotates inward, or if the foot rotates inward, we can have problems with that IT band. So this hip will rotate inward if the pelvis tilts laterally. So this would be incorrect running. What's happening here, this particular person is landing, and when they land, the pelvis is actually tilting this way, which causes the femur bone to rotate inward. When that bone rotates inward, it'll actually cause the IT band to bang right up against the femoral condyle, and it creates pain. The biggest reason why this pelvis doesn't stay level and tilts is because of glute weakness or buttock weakness. The other condition is when the foot rotates in. When the foot rotates in, it causes this shin bone to basically angle inward, which then also causes the femur bone to rotate in, and it causes the IT band again to bang up against that femoral condyle. Now, the reason the foot will pronate is because of a condition where the back side of the heel lands a little more on the outside. Now you can see there's a lot of room. This is the ground, this is the back side of the heel hitting on the outside. Now there's room here for the inside of the heel. It's got to find the ground fast. When it finds the ground fast, it causes the arch to collapse, which then causes the knee to rotate inward, which then causes the IT band to bang up against the femoral condyle. So our job in therapy is to figure out why you're having this problem, and we do running analysis. So we videotape people running and we determine, is the pelvis staying level? Is the foot collapsing? If those issues are apparent upon a running eval, we can correct those easily, either putting an orthotic in the shoe or by developing a very good strengthening program to make sure the pelvis stays firm. If you have any problems with any running injury, please don't hesitate to call me. Our number here is 218-346-2464. Thank you again and have a great time running.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, and Mojave Ottawa Community Action Partnership.